All right, next thing we're going to get into, and I did talk about that screening just a minute ago. That's just a list of what they do is they use Doppler ultrasounds. It's not radiation. What it is they're going to scan your organs. So all the vital ones like your pancreas, liver, kidneys, spleen, gallbladder, thyroid. They're going to check your carotid arteries, and then obviously the aortic artery that goes down is the descending abdominal aorta. And every year we have patients that, they've got plaquing going on, they got fatty livers, and it's just something that you should probably do over the age of 40, probably every 5 years. Okay. All right, now we're going to start talking.
45?
You can. Well, you can. I mean, everybody's different.
40 this year, so
Okay.
I got 5 years yet, right?
Well, you can
better
stick,
go in on
you
Thursday.
can stick your head in the sand, or you can be proactive in life. Now, the next thing I'm going to talk about is something called science-based nutrition, and the way I approach it is there's really two people in this world. Okay, either you're not taking what you should, and you should, and then there's other people that are taking grocery bags of supplements and they're just wasting their money. And the problem is the internet is a plethora of useless information, and there's all these websites out there. It's like, well, if you have this, then you have low energy, you gotta take this, and month after month and month. Before you know, you're taking all this stuff. So I use a program called Science-Based Nutrition. There's Dr. Merkel, he's out of Dayton, Ohio. I've been doing his work for about 10 years now. And what we do is we basically take in, it's your symptoms of what's going on with you, and then I recommend blood work, and this is a basic foundational panel that you're seeing there. And then the third thing is okay, if you're 200 pounds and 50 years old, and you're a 100 pounds girl, if you're a 200-pound man, 50 years old, on blood pressure medications, and you're a 100-pound girl that's 25 years old and taking birth control, you probably need different supplements, okay? And you see, a drug is not a drug unless there's a side effect, and most drugs have side effects of certain things. Most of your cardiac drugs, big things, ubiquinol, CoQ10, your B vitamins. These are all things that basically we factor in what you're on supplement-wise, and then obviously your height, your weight, and a 200-pound person needs a different amount of maybe vitamin C than a 100-pound person. So we take all those three things together, and then we come up with a game plan. And that's why I wanted to talk about the half-life at the beginning. Is half-life for, well, vitamin D, the half-life is 15 days. The half-life...
Does that mean that when you buy a bottle of vitamin D pills, they last longer than 15 days to go through that whole bottle?
No. You see, here's your, let's...
I'm not understanding the 15 days.
Right, okay. Let's look at it this way. Okay, your fat-soluble vitamins are all measured in IUs, international units. Okay, most of your other B vitamins, vitamin C, are either in micrograms, milligrams, okay? And so this is an example. It's measured in deciliters on your blood test, okay? And just to maybe jump to the back there. Okay. You know what, do you mind if I just answer that question when I get to that part here? Okay, so we'll just come back. But when we talk about half-lives of an organ, for example, the half-life of your liver is 6 to 8 weeks, which means you can either kill it or you can rehab it in that window of time, okay? So when I do blood work on people, it's not about doing blood work and then that's it, okay? What you do is you do the blood work, and we typically will retest you in 60 days to see if what we're doing is effective. And I may give you a diet, I may give you a list of 5 or 6 supplements to take, and that's the strategy. It's kind of like, it's a journey, it's not a destination, it's a journey, okay? So what I'm gonna do here next is just kind of go through the basic tests themselves. And if you turn over, I got a quick reference guide, and for example, glucose, you're gonna see there, if it's low, you're hypoglycemic. If it's high, you're diabetic. And that's kind of what you're checking in the last 24, 48 hours. There's something called the Hemoglobin A1c, and what that measures is really what you did in the last 6 weeks. So if, let's say, you were abusive to yourself the months of November and December with just partying and going out for the holidays, then a lot of times you'll see that thing change. So it's really considered like a wellness test, an anti-aging test. Uric acid If it's low, it's a protein metabolism. If it's high, it's gout. And a lot of times we think, well, who has gout? Well, the middle-aged guy that's overweight. Okay, the youngest gout patient I ever saw was a girl that was 12. Okay, and the thing is, she's going to be a D1 athlete in softball somewhere. And her bad thing is her dad's got a bad genetic expression. I've known her for 20 years, and unfortunately, she inherited that. So that's an example there. The BUN, the creatine, the BUN ratios and stuff like that, once again, if it's low, it's usually a metabolism problem. If it's high, you got kidney. Now we're getting at a whole bunch of different minerals here, and again, it's one time, it's if it's low, it's this. If it's high, then it's like for magnesium or something. You got thyroid or kidney issues. So the big thing is when we say the word foundational assessment, okay, it's like a car. Okay, you can't get by with 3 tires. You need 4. You need a muffler. You need all the systems that interact together. All right, I'll just let you kind of read this through the next 2 pages, but just kind of highlight some of the high ones. If you see the one alkaline phosphatase, okay, if it's low, you got a mineral deficiency. If it's high, you may have bone cancer. Unless you're a teenager, and if it's high, then you're still growing. So there's all these factors that you look at age of people. Next thing you know, you're getting the SGOT, the SGPT, and once again, that has to do with your liver, gallbladder, it's digestive stuff. Does anybody, if let's say you're anemic, what's the first thing that pops into your head that you think somebody needs?
Iron.
Okay. And does anybody know what a ferritin test is? Okay. What a ferritin test is sometimes people overabsorb something. Okay, and if your ferritin level is high, it's a condition that affects about 10% of the population, and it happens in males and females. It's a little more common with women that are menopausal. But what happens is because you normally had a menstrual cycle, you're passing blood every month, well now if you stop to do that, your body is overabsorbing iron, okay? And the problem is if you overabsorb iron, really toxic to your liver. That's a good way to cause liver damage. And so the strategy for a hemochromatosis patient is donating blood, okay? And obviously cutting back on red meat. But again, it's just like all these are all just a couple little clinical gems I'm trying to show you tonight. And the next thing in here is, you're seeing cholesterol and triglycerides and HDL. And the HDL is the one that's important. You can change that with diet, exercise, and then you got to be careful with the other ones about just doing too much red meat and certain things in your diet. And everybody's different, okay? There's certain people that can eat a lot of red meat and it doesn't affect them, and other people, they can't have it at all. You're seeing a section in there with thyroid. You got the T4, the T3s, the T7s, and basically either you got a low or a high function. And the reason I brought up the whole thing about the sperm and the egg is going back to the beginning, is one system is very dependent on the other for activation. And a lot of times, just as a side note, because I know we're here about neurodegeneration, but when you talk about cancer, we dropped the bomb in 1945 on Japan, and we killed 250,000 people, okay? Do you know how many bomb blasts the United States did between 1945 and 1992?
In the
Yes.
United States?
Yeah. Yes.
I don't know how many, but I know it's New Mexico,
Yeah,
Four Corners, and all this.
Yeah.
I know it's highly probably radioactive.
Yeah.
Still,
1,056.
thousands.
Yeah. And then across the world, with Russia and China included, then it's
I remember when that
2,000.
cloud was coming across from the last one they had.
Yeah, and that's one of the things too is, it's one thing to put too much caffeine, alcohol, nicotine, trans fats in your diet, but the thing is, we are, like you just nailed it here, is California, Nevada, New Mexico, Colorado, Arizona all have higher than normal uranium levels, so there's toxicity in our systems that we're constantly trying to battle.
Water.
And water. So so that's sometimes too, it's going to affect your thyroid function.
I was under I can't say it now.
Regarding.
The accident over in Russia.
Chernobyl?
I was under the Chernobyl cloud. I lived in Germany at the time.
Yeah,
So
sucks.
I've been watching for things ever since.
Yeah. Well, and you see, that's the whole thing is when you look at your blood work, there's things that are patterns that you're trying to change. Okay, and that's why, like I said earlier, typically just when we look about liver detoxification, is we typically will sometimes then retest in 60 days, and if we nailed it, good. See me next year. If we didn't nail it, then we got to retest and find the strategy that's going to work for you. All right, we're talking about just the blood cells. Again, if you got a chronic white blood cell, that's usually a bad immune system. Chronic infections, if it's high, it's an acute infection. A lot of times your red blood cells are the rest of that column, those next 6 ones down there, where you're looking at a lot of times vitamin deficiencies, okay? And then the last, your 5 white blood cells are your neutrophils, your basophils, your lymphocytes, your eosinophils. And again, they can be related to allergies, everything. It always works together here. And then we'll get in this color code here in just a moment. Now the last 3 tests there, you see in an ESR, it also means sed rate, and then you have a C-reactive protein, a creatine kinase. They're 3 non-inflammatory, they're non-specific inflammatory markers, okay? And the ESR tends to be more allergy related. The C-reactive protein is more muscle, creatine is a little more cardiac, but they all kind of, you gotta look at them all working together as a team, okay? All right, the sheet here that you're seeing with the color-coded is, you're gonna see that it says there's a healthy range and a clinical range. And just take the one at the top there, you got glucose, okay? Let's say somebody comes in with hasn't been to a doctor in years, okay, and they get their glucose tested and it's 400. That's just a diabetic that's never been diagnosed, okay? And the clinical range is like you're seeing, it's broader, it's 65 to 99. The healthy ranges are always going to be narrower. Okay, it's like in school, you have some special needs, you have some Einsteins, so it's everybody mixed together. But what you want to do is be in more of the healthy range. Now, if you're in the healthy range, like you can see up there when they had the retests done, it was 84, so they got a little star next to them. Originally, they were 178, which means it was clinical, okay? And we color code this stuff, so yellow is a warning, red is more of a risk, and blue is code blue. It's like, it's the emergency room, you're going to die, okay? It's like if you're walking around with a bunch of blues here, your chance of getting sick, or obviously your nervous system degenerating, is going to go way up. And I don't freak out so much about the yellows, but you just got to get rid of those reds and blues, okay? All right, so at that point now, and I got a half hour into this, I hope I'm not boring everybody to death. Going back to half-life of vitamin D and then the supplement, Barbara, okay? So, like I said, vitamin D is a fat-soluble vitamin, okay? Now, you're going to see down here at the very bottom, the clinical range when you talk to an MD, they're saying, hey, if your vitamin D is 30, you're okay, okay? In my opinion, you want to have your vitamin D level at least 50 to 70, okay? And so the way you can strategize that is, let's say you're not taking any vitamin D at all, okay? If the half-life is 15 days, and let's say I come up with, I take this whole, you see what we do is we generate a report that's about 15 pages long. It breaks down each system. It'll talk to you. It's like, okay, you know, you got high cholesterol, you got a cardiac risk profile that's increased. The supplement for that might be, let's say, an omega-3. Okay, so for you, it's like I may need 10,000 international units of vitamin D to maintain that 50 to 70. You may need 3,000. Okay, and so an easy strategy is let's say you don't take any vitamin D and your vitamin D is 30, okay, and let's say that we give you the 3,000, well, 15 days of that is 50%. Another 15 days of that is another 50%. So what you could then do is after 30 days, measure your vitamin D and see, are you in the right range?
I see.
Okay, because it's no different than driving a car, okay? You put duct tape over your speedometer, and then you think you're going 55, and the cop pulls you over, and you're going 71. You know, and see that's the whole thing where you see blood work doesn't lie.